Being in medicine is a chosen career passion for me, and I knew beforehand that there would be daily challenges.
I think all of us have challenging patients, right? Whether it is needing to consult a colleague on a difficult case or needing to lean into our support staff to better support our patients who might struggle with noncompliance. Patients tend to be a very frustrating part of the job, a very challenging part of the job at times, but they're also the reason why we do it. So I think leaning into that team and working through those challenges is super rewarding.
There is challenges of staffing, but we as providers have to help overcome that challenge. So along those lines, in our clinic, how we have helped with that was our providers being involved in triage. We have helped to sometimes even room patients, clean rooms between patients, and anything that we can do to work as a team and to provide the best outcome for every patient every time.
One of the big things which we're seeing kind of nationwide is staffing shortages. But one thing that I've really is helped me get through it are the people that I do get to work with.
Working in healthcare has many challenges, and I think meeting the demands on every given day can be very straining. There's a lot of unpredictability and unanticipated challenges, and most days there's probably more work than what we have time for. I think that taking time for yourself outside of work and making time to do things that bring you joy help you show up to be a better doctor.
My patients are the most challenging part of my work. I like that I see a wide variety of kids with various medical conditions, some of them very straightforward kids who are typically developing and some of them who aren't. I like to use my brain to figure out these challenges, and I'm not worried I'll be replaced by a machine anytime soon.
Overcoming trust barriers with patients, families, and even some of our staff during the pandemic, when it came to things as simple as treatment options or the idea of vaccination and whether it was going to be safe. It definitely took a team effort, and it definitely wasn't something I had to do all by myself.
Initially, when I first started with Unity Point, I was not only new to the organization, but I'm also a new provider. So I think I made the rookie mistake of thinking I have to put 100% of my effort into patient care, and it came with time, but realizing that in order to be a good provider, I needed to also have that good work-life balance and focus on myself and focus on my family. So my family, I think, was a good anchoring point for that to kind of help remind me.
Right now, the hardest part of our job is just how much people are really struggling. They're coming in with a sore throat or a cold or UTI, and the next thing we know, we're talking about a past trauma, their anxiety, their stress level, how they're barely surviving. So I've had to get a lot better at protecting my own time, my ability to exercise and meditate and spend time with my family so that I continue to have something to give every day when I come in.
So I think one of the things that can be challenging in day-to-day work as a physician, particularly in primary care, is just the number of patients that maybe need you or the time from you or your team. And I think the thing that can get you through that is remembering how much of an impact you have in the lives of your patients and their families. When I started residency, I got advice from a mentor, and it was to keep all of the cards and mementos that I get from patients and families, and I do that, and reflecting on them on maybe my worst days, and just helps me remember the impact I have and the good that we do here.